Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preparing your child for surgery. Part 1. Introduction. This patient education program will help you prepare for your child's surgery. Planned surgery involves 4 steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. During the surgical consultation, the patient and parents meet with the surgeon to discuss the surgical treatment options and discuss the benefits and risks of surgery. This program is designed for parents of patients who have already been scheduled for surgery. The purpose of the pre-surgical visit is to make a plan for anesthesia. On the day of surgery, if you are not already admitted to the hospital, you will check your child in with admitting before going to the pre-op area. At this time, your child will be asked to change his or her clothes, and you will meet with the hospital staff who will be taking care of your child. After the operation, your child will be monitored in the PACU or recovery room. After surgery, the patient sometimes goes home the same day but may have to stay at the hospital for additional care. When patients go home, they are given discharge instructions on what to do after leaving the hospital. Waiting for surgery. After the decision has been made for your child to have surgery, there may be a waiting period of as little as 1 day to as long as several weeks. On the following pages are some tips to help you prepare for your child's surgery. Find out from the doctor whether your child is going to be an outpatient or an inpatient. Outpatient means that the patient goes home the same day as the surgery. Inpatient means that the patient stays in the hospital after the surgery for 1 or more days. This is often talked about during the surgical consultation. If your child is not already in the hospital, the surgeon will tell you the dates of your child's admission and surgery. If you have other children to take care of, it is best to make arrangements for someone else to take care of them while you are in the hospital. 1 to 3 days before surgery, you will get a phone call with information about the time of surgery and the time you should get to the hospital to check in. Always try to tell the truth. If your child asks a question, be honest when you answer. If you do not know the answer, tell your child you do not know and ask your nurse or doctor for help. Honesty will increase the faith and trust that children have in their parents and the medical team caring for them. Pre-surgical visit. Some patients are admitted to the hospital on the day of surgery. However, in some cases, the patient may need to be admitted the day before. During the pre-surgical visit, a member of the anesthesia team examines your child and reviews his or her medical history. He or she will do a physical exam and ask you questions about your child's health and your family history regarding surgery. Blood and urine tests as well as other tests may be needed. It is important to let your doctor and healthcare providers know if your child has had any special medical tests in the last 6 months. If your child has had any, you may be asked to bring results or have them sent to your doctor. Be prepared to answer a lot of questions. On the following pages are some examples of questions you might be asked. What prescription medications is your child taking? Is the child taking any non-prescription medications or herbal medications? Does your child have any allergies to drug or food groups? If yes, what is he or she allergic to? Is your child allergic to latex? Has your child had anesthesia before? Do you know if any blood relative of your child has had problems with anesthesia? You should tell the anesthesiologist about any medical problems that your child might have, such as asthma, heart disease, diabetes, seizures, or other nervous system abnormalities. Please report any changes in your child's health, including colds, fevers, nausea or vomiting, flu, or exposure to communicable diseases. Medications your child may be taking could interact with anesthesia or could cause excessive bleeding during surgery. Therefore, it is very important to tell the anesthesiologist and surgeon about any medications your child may be taking, even over-the-counter medications such as aspirin, Advil, ibuprofen, or herbal supplements. If your child takes medications, find out which ones should be taken before surgery. The doctor may ask you to change the schedule and dosage of your child's medications before the surgery. The anesthesiologist will determine the best medicine for your child. Anesthetics are medications that are used to keep the patient comfortable and pain-free. There are 3 basic types of anesthesia: general anesthesia, regional anesthesia, and local anesthesia. General anesthesia causes the patient to go to sleep and not feel pain. General anesthesia is either given through a mask or an IV. Regional anesthesia is used when a whole region of the body, such as an arm or leg, needs to be numbed or anesthetized. Examples of regional anesthesia include spinal anesthesia, epidural anesthesia, and nerve blocks. Local anesthesia is used for numbing specific limited regions of the body, such as a skin area. Dentists use local anesthesia to numb the nerves of the teeth. The risks depend on the type of anesthesia and on the child's current medical condition. The doctor will discuss these risks with you. You can do a lot to prevent complications by telling the doctor about your child's allergies, medications, and diseases. Anesthesia is safe. However, there are some possible risks and complications.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
The night before surgery. Your child will be asked to stop eating and drinking several hours before surgery. This is important for your child's safety. Make sure to check with your anesthesiologist as to the specific eating restrictions before your child's surgery. These restrictions differ depending on the age of the child, his or her general health, and the type of anesthetic given. Examples of clear liquids include water, fruit juices without pulp, carbonated beverages, and infant electrolyte solutions such as Pedialyte. The definition of a clear liquid is a liquid you can see through. Your child may be worried about coming to the hospital. Encourage the child to bring a comfort item from home. How your child handles being in the hospital will depend on his or her age, developmental level, and past experiences. How you react will also affect your child. It is helpful if you try to be calm and matter-of-fact about tests and exams. Your child may be anxious before the surgery. You can help your child through this stressful time by talking to him or her about the surgery in advance, approximately 1 day per year of age, and answering questions honestly and age-appropriately. If your hospital has a child life department, you may call them for suggestions on how to better prepare your child or to schedule a hospital tour. Even with preparation, some children may need medication to calm them before surgery. The type of medication may be given by mouth, nose, rectally, or by IV. Your anesthesiologist will decide if this is needed.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. Parents are key members of the healthcare team. Only you can give the special loving touch that is vital for your child. As the parent, you know what normal is like for your child, what a certain cry means, or when something is just not right. A visit to the hospital may be an anxious time for both you and your child. Your doctor and nurse are available to answer any questions you may have about your child's scheduled surgery. Thank you for using Explain.